Quick thing to remember before we start. I'm a student, not a doctor. This video is for educational purposes only, so always chat with a healthcare professional for personal medical advice. First up, let's talk about responsible parenthood and family planning. You hear this term a lot, but what does it actually mean? According to the World Health Organization, it's not just about birth control, it's about empowerment. It's the ability to decide if you want kids, how many you want, and when you're ready to have them. It's really about life design. When people can plan their families, it leads to better health outcomes for mothers and children, and it gives you the freedom to finish your education or establish your career first. So, how do you actually stick to that plan? Well, you've got options. The Mayo Clinic breaks birth control down into a few main categories. First, you have your short term hormonal methods. These are things like the pill or the patch. They work great, but you have to remember to take them on a schedule. Then, there are long acting methods like IUDs and implants. Think of these as set it and forget it options. They are highly effective and last for years. When you're choosing a method, the CDC says you need to look at three things. Is it safe for you? Is it effective? And does it fit your lifestyle? But here's the catch that a lot of people miss. Methods like the pill, the patch, or an IUD are great for preventing pregnancy, but they do zero to protect you against infections. That brings us to the other half of the topic, sexually transmitted infections. Here's the scary part. The CDC notes that many STIs are asymptomatic. That means you or a partner could have one and feel perfectly healthy with absolutely no symptoms. You might not even know you're passing it on. So, how do you stay safe? Prevention is key. The Mayo Clinic recommends getting vaccinated for things like HPV and hepatitis B before you become sexually active. They also suggest being smart about your choices, limiting your numbers of partners and aiming for mutual monogamy reduces your risk. And honestly, get tested. Knowing your status is the only way to be sure so you can get treated if you need to. If you only take one thing away from the video, let it be this. Major health organizations like the World Health Organization and the CDC all agree on one fact. Condoms are the only method that does double duty. They are the only tool we have that prevents both pregnancy and STIs, including HIV. Whether you use latex or polyurethane, using them correctly every single time is your best defense. Taking care of your sexual health isn't just avoiding risks, it's about respecting yourself and your future. Thanks for watching. If you learned something new, hit that like button. And don't forget to consult your doctor for advice that fits your specific needs. Stay safe, everyone.